gonna start. I am gonna say thank you to Dean White Ryan and Connor White, who is our communications person. I am Lauri Goldkind. I am an associate professor here at GSS, and I teach in the foundation year. I teach human rights and social justice, and in our advanced year, I teach mostly macro practice, supervision, and staff development and fundraising. And we used to have this beautiful course called Administration 1 and Administration 2. And I will tell you, I am thrilled that our guest tonight was able to join us because she was in my very first class here at Fordham. And I'm so proud of her accomplishments, so I have almost nothing to do with them. And so, Amy Montimurro, I'm so grateful that you're able to join us tonight. Amy is the executive director and CEO of Abilis, which is a nonprofit in Connecticut that serves people with disabilities from birth through their senior years. It is one of the biggest providers of disability services in the state of Connecticut. She's worked for Abilis for 27 years and graduated from Fordham in 2008 or 2009. We're not exactly sure. She started her career in entry-level roles across the agency and worked her way up to executive director. And she is really a leader in her field. And I am thrilled to have her share her experiences with you tonight about her professional trajectory. And so Amy's going to tell us about how she started with Abilis and her pathway. And then we'll open it up for questions. Amy, I'm just going to turn it right over to you.
Sure.
Can you hear me okay?
All right, terrific. Well, starting out in social work, a lot of times you don't know exactly what area you want to work in, what population. So I was very fortunate. I identified this in high school, and I started volunteering for Special Olympics and fell in love with working with people with developmental disabilities. So I've grown up in the field, and this has always been my passion. So it was easier for me. I didn't go through the struggles of trying to figure out what I wanted to do. I knew early on what I wanted to do. I started through undergrad working in residential group homes with people with disabilities in New Jersey and New York. And in 1998, I moved to Greenwich, Connecticut, and started managing residential group homes for people with developmental disabilities. During the time, I always looked to expand and learn different areas within the organization that I wasn't familiar with. I always asked for additional responsibilities, wanted to try different things because I knew I loved working directly with people, but I wanted to be able to make a bigger change in their lives. I continued. So after I was managing homes in 98, 99, in 2007, I became the director of adult services at Abilis and overseeing all of the services from vocational, recreation, residential. And when I started, we had probably 9 residential homes, a very few employment services. It was a time where there was a shift and we were going from sheltered workshops to community-based. And when I assumed that role in 2007, our board of directors said, you need to get your master's degree. So I said, okay, that works. I will do that. And I went to Fordham, and as Professor Goldkind said, I was in her first class. And I was, Professor Goldkind was in Lincoln Center, and I was over in the Westchester campus. And the focus was administration. Is it still administration? Do you still have that concentration now?
We have some macro courses. We don't have a distinct administrative track, but we definitely have a macro focus for students who are interested.
Okay. So I was one of 3 students at Westchester, and we were connecting remotely with Professor Goldkind, and I learned more than I really thought I was going to when I first started, and how much I really was able to get out of the program that would help me on my trajectory and development. So I continued in that role until 2018, when the CEO position became available, and right before COVID. So it was, I guess, good timing somewhat. Depends how you look at it, for me. And I've been in the role ever since. And, my focus, when you're, has always been working with the individuals. I learned early on, it's not just about the individuals, it's about the families and how much support they need from us. And, really looking to the community to see how they're going to support the organization. And I can tell you specifically, when I was working at Fordham, the different things that really helped me, was taking a grant writing class. I was able to learn how to, do literature reviews, and, we have a responsibility to raise $2 million a year, and really understanding how to write a grant, what you need to look for, understanding what your goals are for an organization, for your clients. We're looking to see what the needs are within your community, and figuring out how to connect the community to our organization. And since I've assumed this role, I really used, all the partnerships and relationships that we've had, and expanded the organization a great deal. And it's not me, myself. I mean, the one thing that I will tell you is our workforce is our greatest asset. And I think the most important thing is understanding that there's never the I, there's no I in the word team. I'm very fortunate to have really a dedicated workforce that, we've worked together for many years. So it was not so much easy when you assume the role, because they're colleagues first, and you have to kind of transition. But it's been really fantastic. Everything we do now is community based, where we've expanded to 63 different residential locations now in Lower Fairfield County. And we've developed businesses, cafes. We used COVID. It was interesting that during COVID was our biggest expansion period. We partnered at first with, there was an RFP that I had seen in the newspaper for a cafe at the Greenwich Library. So the team got together, we wrote the RFP, we submitted it, we presented it. It would be an inclusive cafe that would employ people with and without disabilities, and it would allow for the community to be part of this wonderful opportunity. And we had started, and 6 months later, I started receiving calls from other libraries and YMCAs and different locations. Now we're operating 5 different cafes. One is actually on an island in Greenwich. We have a group that takes a ferry over and employs people with and without disabilities. And the state of Connecticut is one of the only states that defines service delivery by IQ. And so that means if you have an IQ below 70, it's great. You'll have services for vocational training, residential training. But we all know that there are many people that could have an IQ of 90 or 100, and they can be functioning at 42, maybe those on the autism spectrum, or other people that just have a high IQ and other issues that really prohibit them from functioning. So we've partnered with different parts of the state to find different funding streams to expand the population, because we really were focused first on those with intellectual disabilities and developmental disabilities. And now we've really expanded to meet the needs of the community, and not just, what we're funded for, which is very typical of an organization like Abilis. So what else can I tell you, Professor Goldkind? I can.
When you are working with supervisors and staff on recruiting like new recent MSW graduates, because we're coming into graduation season, what are you looking for in your prospective hires?
somebody that's going to take initiative, outgoing. We know when we're interviewing people if it's going to be a good fit for the applicant and our workforce. We have the mindset as all hands on. Everybody jumps in and helps each other for new projects, and then everybody kind of takes on their own role. But it's really a team effort. So we really look for applicants that are, like to work with other people, like working in teams, and want to take initiative, have their own ideas. All the different things that we've accomplished is not certainly my idea. It's all of everybody's ideas and outreach and connections. The workforce, it's been, they've really pulled together, and we're able to accomplish it because of that.
Amy, I've got a question. So when you're, following up on Dr. Goldkind's question about what are you looking for, do you advise that a new social worker interested in working with people with developmental disabilities or other areas, that they get some experience in direct practice before moving into? Very often students say that they would like to hold a management or a leadership position. What is your best, what can you tell students about who are getting ready to graduate? What do you think about career trajectory? What is the best way they can approach it?
In this field, in most states, you will find that there are not a lot of positions in organizations and private nonprofits that will say social workers. So most times, like myself, I started direct service, working in the houses, helping people vocationally and residential. And I took on the role of a program manager. So it might not say social work, but it very much is. You're working, you're coordinating, you're meeting a team of staff that are going to implement the goals and, behavior support plans and coordination with nursing and making sure that people have, a full and meaningful life and they're healthy. And then similar roles would be in employment. But there's always a bit of direct practice. Even today in my role, there is nothing that I'm going to ask anybody to do that I'm not going to do myself. And we work directly with our clients, and, you have to be willing to do that. In this field, there's very few you're going to walk into having a case management roles. Because there's not funding for it. They want the state reimburses for direct service, they reimburse for oversight, but really the different positions that we've created primarily actually for Fordham students that have been with us and interned with us, and we did develop positions for them once we were, once we grow enough and we have the ability to cover those types of overheads, that's when we're able to do it. So we know how important it is. But, if this is a field that you're interested in, you have to, kind of push yourself and take on some supervisory roles.
And I just want to follow up on one thing. You said something that I think is so incredibly important. You mentioned the families and supporting the families. And, no one is raised in a vacuum. And I think families, do you provide education and support for families, or how do you include families in your support of the people that are getting services from Abilis?
So we're a birth to earth provider. So we start from the initial, I know that it is limited. It is. We start from the initial diagnosis. So, we're with babies in the hospital, and new moms and new dads, they're just trying to swallow the fact that they have a child that's not going to, is going to be a different journey than what they expected. So we do have social workers that are working in that area for our therapy center. And throughout, their lives, we continue to provide the resources and support. So the early intervention up to age 3, has that social work coordination supports for families until they enter into the school districts when, the schools pick up. We now take insurance so that our families can stay with our therapists that they've grown so, attached to. Then they need kind of a soft landing once they come from the high school to then the adult world, because it is another different experience. So, we spend a lot of time trying to help them, understand what the opportunities are. And a lot of what we've created here is really to meet each person where they are. So we try to work with our families when their children are still in high school so that when they're aging out, we're ready for them. We know what kind of job they can have, what kind of volunteer opportunity, where are they going to make friends, where are they going to have fun, where are they going to live. I used to think, the parents were such a pain, they call me and this and that, and they bother me. And the truth is I've learned so much from them that, they know their children better than we do, certainly. I realized that they need some peace. They need to know that when they leave their children with us, we're going to take care of them. And there are many times where their children don't speak. So, having that faith in an organization is really, special to us. We know what that means, that a family is entrusting us with their child who can't tell them exactly how their day was or what's going on. So, it is, they used to say interdisciplinary team. Now we use individual support team, the families, and we're trying to reach out to siblings because we want to make sure that when parents are no longer there, that the siblings are educated about, and we want them to advocate and we want them to hold us accountable. We want to make sure that their children are really receiving the highest quality of services.
Thank you. That's really, really incredible. What you do is incredible. Thank you.
My pleasure.
Fordham's finest, thank you very much. I have a question though, for somebody who's coming into Abilis, are you able to offer them clinical hours? Like if they really are clear that they want a clinical pathway, are you able to offer them clinical hours? I don't know the licensure in Connecticut rules, but in New York, I know that you need like X amount of clinical hours, right, to sit for that next level of your license. And is that something that Abilis offers?
Yes. We have a certain number of students that we were able to take. We're working with a number of universities now. We do have an LCSW who's kind of overseeing. We have other LMSWs who have participated in the CIFI program. But to get your hours for your LCSW, you need to be under, right? You need to be under the LCSW. So as long as we're not, really overwhelming our clinical social worker that's on staff, we're happy to help. And, individuals benefit from it. People forget they have relationships, they have issues with their families. And, the state does not provide counseling for people with disabilities. Once they're aging out, their benefits are really very limited. Their entitlements don't cover a whole lot. So the social workers that have joined us and have been with us are doing an outstanding job. And they really, our expansion of population is new for the organization too. So we were working with people primarily with intellectual disabilities, and we expanded. We have people with, individuals with schizophrenia, mental health, dual diagnosis, different issues. And the Fordham actually students have been fantastic working with that population with the support of the licensed social worker.
Oh, Amy, before we open it up to questions, I wonder if you could just tell us a little bit about like where you think disability services is. Like you've talked a little bit about how you're kind of thinking about expanding what the range of offerings that Abilis can do, right? Both on the family member side, but also on like the different types of disabilities. But I wonder if you could talk a little bit about like where do you see disability services going in the next like 5 to 10 years?
Well, I really can speak just to the state of Connecticut, really. I mean, I think, I'm really all the states. I mean, I think technology is on our side. So I think all the different states are really looking for technology to help people to become more independent. They're trying to, find ways that, through the American Rescue fund. They've really offered to all the different states funding to, help people to, be able to have more time alone in their apartments. And, there's different technology, self-regulating technology. There's these new watches, I think, Professor Goldkind and I have discussed, and there's, medication administration, machines that you don't need a physical person to come in and help. And, there's some families that are not so happy because they're afraid that's going to lose the human connection and they're going to be replaced by machines. And it's really not the case. It's really giving people that self-confidence, self-worth of being able to self-regulate and be independent and still have the staff come and help you when you're always going to need some, staff, that engagement. So that's not going to go away. I think smaller facilities, apartments, having, fewer housemates years ago. I mean, obviously there's deinstitutionalization. There were these large facilities. They've gotten smaller and smaller and smaller. We don't open any type of residential group home for more than 3 people. You need 3 people sometimes because if they need a higher level of support, you need to bring in funds together to be able to hire the staff. But everything we do, and I think most states are looking for ways for people to be as independent as they possibly can.
Thanks. It's really interesting. It's not a population that we have a specialized course in here at Fordham. And so for, I think a lot of our field students being at an AHRC or at an Abilis is the primary place where they interface with the disabilities population. So I think that's really, really interesting. And both on the executive leadership side, but also on like the population side. I want to open it up for questions. Dean White, unless you have other questions.
No, thank you so much. This is great. It's just such interesting work and so, I think, so important for students to understand. Do students have questions that they would like to ask Amy about? Any area of interest in developmental disabilities or career trajectories? There you go.
Diane and then Melissa. Hi, Diane. Good to see you.
Oh, hey, nice to see you too. My very first professor at Fordham.
Oh,
Yeah. Thank you so much for all the information. I'm in my first generalist year, and I'm currently at a nursing home that I'm finishing up my field placement. I don't know if this connects a little bit with the disability, but something stuck out. I'm going to stick around as a volunteer. They're really in a bare bones situation for staffing, not only medical staffing for safety and medical protocols, but psychological support and just social support and including people. So sticking around during the summer, but you said something about the organization to be a part of the, like getting organizations outside in the community to be a part of the organization itself. It's located in Dobbs Ferry, and the idea is to reach out to the counselors at the high schools to have their kids do the community service at the nursing home. But another idea I thought of, they're smack dab in the middle of this community. I know there's a lot of community pride, and, I feel like the community could somehow support the nursing home as well, whether it be volunteerism or just funding for the supports, the staffing situation, as you all may or may not be aware of, is, they're trying to get better, but they've lost the workforce because minimum wage went up and those people went to retail and fast food, and no matter how hard these people work, they could use, 5 times as many people. Anyway, so the idea is, if you have any ideas for me to reach out, I'm just going to sort of try to recruit both students for community service and then get involved in the community.
Yeah, I will tell you, I mean, we've been working on this. We started it, we have a board of directors, very active. We started an Abilis Youth Board of Directors. So we went to all the neighboring towns, all the school districts, and we started a youth board, a very active youth board that they meet once a month. They not only have to do fundraising, but they have to come in and do activities with the people, whether it's in a residence or, Thanksgiving. We have a big celebration here for people who don't have families. So the youth board made pies. Everything is to engage and also just to teach the next generation. right? You want to get that involvement with all the different towns, and having a structured volunteer program is so important. We grew so big, so fast, that I just recently hired a consultant to help me develop the systems that I need so that each department has a liaison and a direct feeder so that, there's one person to bring them in and then make sure you're onboarding and training, because you don't want a volunteer to become and do the same things that a paid staff, is responsible for. That's, really important. So, as much outreach as you can do, we have a Together We Shine coming up, where it's inclusive prom for people with disabilities, and all the high schools are coming. So it's an inclusive, being for free adults, people with and without disabilities, and the entire community. We put social media. We need gowns. How many gowns can I pull out of my closet that I never can wear again? My
Exactly.
dress is coming here tomorrow. I don't have to look at it anymore. But reaching out, if you have, Diane, somebody that's responsible for social media and marketing.
It's really bare bones at this point. You've got a nurse manager for 4 different wings. You've got a few administrative staff. You've got one HR person. And that's why I wanted to stick around and be volunteering over the summer, is to incorporate some of that. That program, they had done something pre-COVID, but they're just getting ready to allow people back in, to allow people back in the facility. So if I mean, I'm being a little bold here, but I'd love, is there a program that I could see that I could emulate like that? Or I guess
Diane, can I just jump in? Are you a student at the Westchester campus?
Yes, I am.
And what is the nursing home that you're at in Dobbs Ferry?
It's Cabrini of Westchester, and
Okay.
it's wonderful.
I know Cabrini well. So let me just share with you that a number of years ago, at Westchester, I was assistant dean at the Westchester campus, and I ran the student congress. It was different than the student congress is today. It was very service oriented. And we did a number of events, the student congress, the students, and it was student led. I got the funding, and we did events at the nursing home. So, maybe some student colleagues would be willing to get together and, do something of that nature as well. So we can talk about it another time, but I love that idea, and I love social work students really can be advocates for older adults.
I love that idea. So, Diane, we're going to connect you and Dean White Ryan, and she will follow up with you about how to make that happen. Melissa, you've been patiently waiting, and then we have a question from Linda Armstrong in the chat. Go ahead, Melissa.
Hello. My name is Melissa. I have a unique situation because I am a online MSW student with a disability. I have cerebral palsy, and because of that, I'm really into the advocacy in Connecticut. And I don't know if you've ever heard of Partners in Policymaking, but it's a self-advocacy program. They're not running it right now, but it's one that teach the people with developmental disabilities and their families to be self-advocates or to advocate on behalf of their family member. And I just want to reiterate that it's, support services are great, but it's also, you have to have it where the person has, as much as they can, has a vision for their own life. And I like to hear about disabilities because in social work school, we don't really hear about it that much, in my opinion.
Yeah. Wait, are you in Connecticut?
Yes.
Okay. Yeah, there's an active, they haven't been really in person. I know they've been doing some Zoom, right? Some virtual things. Actually, our Fordham students they're holding our self-advocacy classes this way. It never stops because we just keep learning and learning. And so they've been doing a really great job at keeping that going. But everything we do is person-centered, and you're right. When we plan, it's first and foremost, what does the person want? What are their dreams? Where do they want to live? How can we help them to get there?
Yeah. I mean, you don't hear about disability a lot in Fordham unless I'm in the class, and then I talk about it a lot because I have lived experience. But thank you.
Awesome. Thanks, Melissa. Linda, you have a question in the chat about career and professional trajectory. Do you want to unmute and tell us more about what you're thinking?
Oh, yes, I absolutely can do so. Give me 1 second. Okay. Well, let me actually turn my camera on. So I've actually been in the field of direct service work for probably since like the age of 16. Um, and because I've done it for a long time, I feel like the focus that I would have had maybe like interest on micro, I don't have that. I've always actually been very interested in macro work. And I think in my experiences of even like currently right now, I'm doing direct like service practice work. So I think for myself, I think a big question for me has been because I've been doing direct service practice work for so long, that transition from this kind of work to something more in the meso macro areas, I guess, because like when I was listening to your story, it was just kind of like hearing that trajectory and understanding like you went from doing the direct service practice work to then kind of going and discussing exactly the stuff that I'm interested in, the RFPs and the grant writing and looking at program development and like, you know, really taking a look at, okay, what does the community need? And, you know, like my coworkers kind of like reference. I can't think of the word at the moment, but they call me like a community warrior because I'm always trying to advocate for different things to come about in our community. So it's just kind of one of those questions that I have for myself as far as like what would be kind of like in those next kind of like steps, like, or what would you recommend? Because I think you had actually, I think you may have even answered it briefly when you was like, you know, maybe that's when you start looking for supervisory things. But I just kind of wanted to know your opinion on like, are there any specific maybe positions that you're like, I would recommend maybe looking at that or going towards those directions?
Are you which area are you in? Are you in a residential? Are you in employment day, vocational training? Where are you?
So I'm in workforce development. I I'm actually doing workforce development with youth and young adults, and I'm also doing a horticultural program at the current moment, which is also why I know about RFPs because I was a part of the team to get that grant to start that program.
Yeah, I mean, I tell everybody, at least for our organization, we always look from within and to see the interest within our organization. What we want to know, you know, when it comes time for performance reviews, you know, not only, you know, how are you doing, but what do you want to do? Where do you see yourself and how can we help you get there? Right. In this field, there is a very high turnover rate. I'm assuming I don't know all the different areas in social work, but I can tell you that the average in the field of developmental disabilities right now is about 37% of turnover. Ours is about between 11 and 12. And part of that was the vaccination mandate that came out from our governor. So otherwise, we were doing very well. I will tell you, Linda, that I did not, you know, honestly, a lot of it was probably confidence initially. And I said, you know, I just didn't want to push myself I hated public speaking. It was like my worst nightmare, have these out of body experiences. But I had to push myself because I just, you know, I knew that I had the passion and the love for what I did. I knew that I respected and cared for our employees, and I knew that I could develop those teams, but I had to push myself to take that next step. So sometimes I took on a different role with supervisory experience, you know, responsibilities. It might not have been perfect, but it was giving me the experience I needed to maybe take on a different role. So, I would keep an eye out, and sometimes people don't want to, I'm not poaching anybody's staff, just so we all know that, but looking around, if there's not an opportunity, that there are opportunities right now in other organizations as well. See where you are. What do you want to, what is your passion, and see if there's a position that, you're able to do the things that you love to do, and then have the additional stuff that you want to learn and grow and take on. But, I will say, Professor Goldkind, does Fordham still go over like budgeting and marketing and development and fundraising and grant writing? I mean, because for me, that was so important for me to have that experience.
Yeah. So we have a beautiful class called fundraising. We
Okay.
have another beautiful class called supervision and staff development, which you actually taught for us before at the Lincoln Center campus. And I think for those of you who, I don't know, I don't remember where I'm teaching our supervision and staff development this summer at summer school. I know we have a couple sections, maybe one section at the Lincoln Center campus in summer school, and then a couple sections online. But we generally run that a few times during the year, especially in the online format. And it's a really nice class. I think nice doesn't mean anything. Sorry about that. It's a great class. It's a great learning experience. I think that we know that the literature says, right, the employment literature says that like within, I don't know, 6 to 18 months of graduation, if you're in agency life, you're going to be asked to supervise someone, right? It happens really quick. And so I think that that's really a good skill set to start thinking about while you're still in school. And similarly, the fundraising class, I think there used to be a big debate about whether a development person, right, a grant writer makes more money than a clinical person. I think we should put that to the side because I'm not sure it's really true anymore. But it's a really, really, really good skill set to have. I think in whatever kind of capacity you might be working in, even if your intention is to go into private practice eventually, that being able to understand, right, like how a budget works and how those pieces work, will serve you really well wherever you kind of end up. And then we have two other kind of strong macro focused classes, advanced practice with organizations and communities, where people do sort of write a proposal and get some proposal writing experience, and the community organizing class that looks at sort of how do you, actually there's one more, but how do you organize stakeholders in a community and help kind of surface community assets. And then the last class that sort of gets at that similar content is program evaluation, which is actually counts as a research concentration choice and talks about like, any agency that has contracts or actually even if you're in private practice, the ability to sort of understand if your choices are effective is a really useful thing to understand. In agency life, we call them KPIs, key performance indicators. How do you craft those to know if your programs are running successfully? So we have, I think, some of the foundational pieces in a different package than they were back when you were with us. But they, I think, especially the supervision and fundraising classes offer a social work experience that's somewhat different than we get in like assessment and diagnosis or like practice with a particular community, right? Like,
yeah. That's great. That's great. And you're, yes, I remember you were telling me, I remember the advanced class because I think I taught that one at Lincoln Center as well. Yes, I did. Yeah.
yes.
But that, you know what, and I occasionally would take different classes on budgeting. The marketing and development piece for me was very new. I had my experience, obviously, when I was at Fordham and it was administrative, we had a section on marketing and development and really how important it was to understand your brand and getting the entire staff to really be the ambassador of the organization, speak the same language, say the same things. It was very helpful, but I had to continue that education and take additional workshops here and there whenever I would see different things. And I was very fortunate to have hired a woman who retired from MasterCard for the NFL. She and then she's now working for us. So, and she really has changed the face of the organization to make sure that, our community knows exactly who we are.
And I don't know if friends feel free to put up your hand or ask a question in the chat. I wonder if you could talk a little bit about, like, on this brand piece, like, about Abilis's, like, social media strategy. Like, what's your social media presence like? Are people are workers just allowed to post on Abilis's behalf?
No, we have a marketing director who has, she has consultants that work for her. One is a PR consultant. We have a graphic designer. She's the only one who posts. So, but all the staff send, different photos of what's going on within the organization. They send it to her, but at least we can control what's getting out and the message that's getting across to the community. I'm not an Instagram person, but I know we have a big Instagram following. I'm still like stuck on Facebook, and that's like as good as I get. I'm sorry. I just don't have the ability to keep up with everything. But I know we have it. I know that the youth have, they're very involved in posting the different things they're doing. And it's very robust. Even, the ask recently to get gowns for the prom that's coming up, I see dresses coming. So it's working. We do press releases for, all of our launches, our openings. I'm very, very fortunate. She's fantastic. And I'm also very lucky. I have a budget that can afford to have these positions as well.
Thanks. Other questions for Amy while she's with us? Andrew, go ahead.
Hey there. So I have a question about compensation. Here in New York, the agency I'm at, I'm involved in the New York State Death Pay campaign, which is just working with at the state and the city level, working with legislation on getting human services pay up. Because there's been a lot of conversation lately about disparity between agencies, nonprofits. There's a big disparity between you working for the city or the government or even like a school versus working in private agencies, where there's a huge wage gap. And I don't know how it is in Connecticut, but I'm curious to get your insights on it. I've just pay campaign this year in New York, and I was actually able to go. I went up with there's hundreds of us back in March to Albany to help fight our cause. So I'm curious to get your insight on all that.
Sure. Well, we have large groups that are going to Hartford next Thursday. We're all doing the same thing, state to state, and the state increased, with a lot of lobbying. We have an alliance that all the organizations are a part of, and they advocate for all of the nonprofits. But when the state increased the wages, they didn't take account of what would happen with the compression. So if you had an employee who's been here for 15 years, and now we have a new staff and they're only reimbursing us at the same rate. So we had to do a whole lot of fundraising to make sure that we're able to, have the different levels of supervision. And it's not just organizations like Abilis. It's all throughout the state of Connecticut, and I'm sure New York as well, because you're asking staff to take on additional supervisory role and no overtime, and now you're an exempt role because so we need to make things right for our staff. So majority of the fundraising that we do is to help that gap between what we're paying and what we're being reimbursed for. But we just keep writing to our state representatives and annoying them and having them come here for breakfast, and going to Hartford, same thing. And I don't know what's going to happen. I'm predicting, there was all this funding that organizations were receiving, at least around here, through COVID relief dollars, everybody was kind of grabbing all of this money. You need to, everybody was expecting eventually it was going to slow down and we weren't going to have, all this extra funds to do all these nice things that we're doing. So, we've had to plan for that and be cautious in our budgeting and continue to advocate just as you're doing, Andrew. It's, you never know. I mean, we don't usually, our fiscal year starts in July. We don't usually get the budget to see what it's going to be until October. So we're just kind of being very conservative with how we operate.
So as an agency, you're supplementing the lack of, or the disparity or the lack of, let's say, COLAs by privately fundraising to get wages in line. Is that what, if I'm saying that right?
Yeah, we do it for wages and we do it for service delivery. Our government is not paying for me to have a food service person operating all these different cafes. They're only going to pay us for the direct service. But if I want all of these things for the people that we're supporting, these different training platforms, I'm going to have to find the money. So we're writing grants, it's all over, and we're successful at writing them. It's a lot of times foundations don't just come knocking on your door, nor are these websites that, you can look it up. A lot of them you have to be invited. So it's doing a lot of research. Who's on the different board committees of all these different foundations? Who can I reach out to? Who may know this person? It's a lot of work, actually. But, to be able to provide those quality services and this gap for our staff, it's in combination about a little over $2 million to have it fundraise.
Let's go ahead.
Hi, I'm Gladys Polanco. I am in my last semester in Fordham, and I have a question regarding to this. I have gained all my experiences through AmeriCorps program. It's a volunteer company, and I also have a disability. So, regarding to that, I would like to gain, I really like to macro dealing with community and helping people throughout the community. And I wanted to get on like a networking and get in touch on an agency where I can apply as a volunteer and provide my skills there. How do I do that?
Within my organization?
Yes. No, I am in New York right now.
Okay. Well,
Yeah.
we're on the border of New York.
Okay.
Greenwich is really very, 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 very close to New York. We're 40 minutes from Manhattan.
Do you have like a connections of agency here in New York?
No,
No.
we're only in the
Okay, in Connecticut.
Yeah.
All right.
but I'm sure people, if you're in New York, I'm sure there are a lot of organizations that can use your help.
Mm. Thank you.
Thanks, Gladys. And Melissa, you had a question in the chat about blending new ideas and older ideas, and I wonder if you could unmute and tell us what you mean.
Because I think a lot of times when you have new ideas in the disability sphere, what happens is the same people have been in the sphere for a very long time, and so they'll say, "Oh, we did that already. Oh, it's never gonna work." So how do you kind of like sneak it in? You sneak in the new stuff.
That's my specialty, Melissa. I love to sneak in the new stuff. I will tell you an example. I don't know if you've ever heard of facilitated communication. It is where people who, don't usually speak and they have somebody touching their arm and they help and they hold. And there's a lot of, people don't like it. It's really a question of who's the author. So for me, I had one family come to me and say, I think this is working for my child. I tried this. It's years ago. It's, I'm afraid I don't know what people are going to say if we have this here. And, my whole philosophy is why not? If it's going to help one person, it's going to help other people. So this man, I'm telling you a very long story, very short, started facilitation. He had autism. He has autism. Does not really speak too much. He had a lot of behavioral issues, very aggressive. He's done a lot of medicine, and now started auditing class this fall at Norwalk Community College, taking archaeology. Sends me these messages. Thank you for helping me find my voice. He comes in here and he types, and now he's even typing without even somebody really touching him too much. So my whole attitude is why not? I think, there are, we will do whatever we can do as long as we can afford to do it, is our philosophy. And it's, we're self-sustaining. That's all that matters. But if somebody has an idea that's going to improve the quality of life, then we'll do it. And I hope other organizations are doing the same.
Melissa, I'll just add to that. And I guess maybe this is like a career kind of piece of advice rather than a management piece of advice. I think that that willingness on behalf of a leader to sort of go places that people might not exactly believe in, but you believe as a leader that that's going to help your clients, that's somebody I want to work for. And so I think like being creative and having a vision is something that was always, when I was in agency life, was really, really compelling to me. And I would say this is not to do as much with Amy's response as like, find the smartest executive director you can find or the smartest supervisor you can find. And that's the person you want to work for. And when you guys are going out into these interviews, because some of us are graduating in the next, I don't know, what is it, Dean White, like the next 3 weeks? You're interviewing folks just as much as they're interviewing you. And so it's really important to work for people who have something that you admire and that they, that you want to emulate, right? And Melissa, it sounds like you want to be with an innovator. And so I think that you're screening for that as much as somebody's like saying, oh, what did you take in MSW school? Because at the end of the day, like that your learning is really going to start in that first job. Even though you just worked really hard for the last 3 years.
Yeah.
Other questions for Amy before we send you all off for your evenings? So I will ask you one last question, then we'll let everybody go and have their dinners. Do you have sort of a piece of advice or two for folks who are going to be entering their first MSW jobs?
I think you just said it real well. I always tell people to push themselves and it might not be the perfect job, but I've certainly learned in social work, there are going to be things you like to do and things you don't. And you're just going to have to accept that. And you're going to have to push yourselves, to take on additional responsibilities. But I think, as you were saying, you should be interviewing, taking a look before you go into those interviews at GuideStar, at Glassdoor, see how other employees are reading their leadership and what are other people, saying about that organization. I guess LinkedIn, right? I'm sure people are on LinkedIn, maybe, I don't know, but Glassdoor I think does. And, I think it's GuideStar, right? GuideStar is like, it tells you, you'll know if an organization is healthy, if they're running a constant deficit, you want to charity navigators. Okay. I should call you. You can keep me up to date on everything. But you want to know the health of an organization, and you want to hear what people are saying about that organization. Is it a good place to work? I would definitely, not all the time, because sometimes you're going to see disgruntled employees that are going to write terrible things. So keep that in mind. But you can also just, do your research and ask questions about that organization. Ask them about their strategic plan. Ask them about where are they going? Where is the organization growing? Is there opportunities for you to take on, other roles within the organization?
That's a great place to end. Amy, thank you so much for this. Has really been a treat.